Hey guys, good morning. Good morning. Dr. Carlos Sanchez here with the Texas Gulf Coast Hispanic Chamber of Commerce. Welcome to the April 3rd, 2020 version of the Texas Chamber Member Daily Update. Long name, Texas Chamber Member Daily Update. Daily Update, though, is the word. In this program, the purpose is to bring you information and maybe to give you a little bit of a focus on your business and hopefully a focus on things that are positive and that can help you continue to grow or even stabilize during these times. There's so much out there that's telling us the contrary, and I want to be sure that at least the members of this organization and even yourself, we do the best we can to stay focused on the things that you want, on the things that are making you successful and making you happy, because that's the way we're going to lead other people in that direction. So thank you for being on the program today. Like I said, Dr. Carlos Sanchez. I'm president of the Texas Gulf Coast Hispanic Chamber, and so this live is for our members, but it's also for you if you're just checking in and what this is about. The whole point of this program is to give you information, but also to give you a little bit of, if we can, a little bit of hope, and knowing that at some point, something's going to give, and we're all going to be going back, hopefully, to something of a normal life that we had before this whole thing started. So also, I want to be sure that we highlight our members' value. There's a lot of members that we have in our organization. We have over 500 members, and many of them have tremendous value that they can bring to your company or to your family, even right now. Even online, even if they can't see you or talk to you or touch you, they're out there and they can actually help you in many, many different ways. And I want to bring that to light. I want you to know who they are. One comment, though, I will say, yesterday my glasses were falling off and they were like this, and something was strange about my glasses. So guys, if you notice that again in me, let me know something's happening. I'll fix it, okay? Because I saw it later and it was kind of funny, but I thought, man, all these people were watching and nobody told me anything. So guys, I'm going to ask you to let me know, give me feedback. If something is not looking right or something doesn't sound right, just let me know. And I'm happy to look for ways to change it or to fix it. Another one of the goals of this program is to stay in touch with you, and hopefully to interact with you. We're going to maybe, I'm not sure, take this to another level and bring it over to Zoom or some other format where you can interact with me, because what I want to be sure we do is have a dialogue. I don't want to be the only one talking, but since this is the third show we've ever done, that might change as we move forward. You might be able to see this program. You'll see it on Facebook Live right now, but you'll also see it on YouTube. So if you go to our YouTube channel, which the links will be placed here on the description, you'll be able to see the program or repeat programs because they were so good and so forth, okay? So that's another way that you can stay in touch. But remember, this program is for you. So if you have any questions, any comments, or anything you'd like to add, send me an email or say it right on the screen. If I can read it, I will. This is why I'm wearing my glasses, is to be able to see the screen, because I know people are saying things and I just don't know what they're saying. But now, it's a little better. So a couple of things I wanted to be sure everybody remembers. The first one is, guys, if you didn't do the census yesterday or the day before yesterday when the census day was around, look at doing the census. Make sure to do the best you can with that, because it does determine, it does define how much money the federal government allocates to this part of the country and what they do for our citizens. So being a part of the census really matters. And this was something that the judge, Lena, I forgot her last name, was trying to talk to people about, but at the same time, she was talking about so many other things that I know the message might have gotten confused. So if you can, if at all possible, to get your census in there, do that. Another thing, of course, is you can start applying for loans, already from yesterday, day before yesterday, but today's a big day. If you go to sba.gov, you can get in line. That's another thing, is that we're hoping that the loans and the money for our members can get to them fast. I asked you yesterday, if you're already receiving money or if you've received any money, let us know. Let me know that something is working for you, because I can actually contact people. Not that I know a lot of people, but they might know me. And as an organization, as a Chamber of Commerce, we can ask them, for some sort of accountability. If things are not happening fast enough, we want to know they're not happening fast enough because we want to expedite and we want to be sure that you have access to capital, you have access to loans and to money to continue to move forward. Remember, you're not alone. Everybody, every one of us, myself, my landlord, other people, other business owners, we're all on the same boat. We're all looking for ways to help one another and to be successful even with these trying times. So whatever you can do, if you hear any good news, let me know. And if it's not so good, let me know as well. We'd like to be able to help anybody who is in need of capital right now. And we have some addresses, we have some phone numbers, and so forth. Okay, so that's a big deal right now, loans and money. There are about 4 or 5 different organizations and people offering free money. So that makes it really confusing, and it makes it really, it's detrimental to a business person. We just want the best and the fastest. So what I'm doing right now, what we're doing as an organization is trying to sift through and find out who the organizations are, what their terms are, and then what we need to do to help you get money as fast as possible, okay? Because there's different types and there's different forms, everything from banks to the SBA to just name it. The federal government and the SBA are working together. So we want to be sure that for business, that we can cut through everything and give you the fastest one possible. So we'll be doing that in this show every day at 10 a.m. Okay, so another thing, if you're feeling weary, if you're not feeling good, if you're not feeling as you might be feeling if it were a normal day, that's normal, guys. It's okay to feel depressed and it's okay to feel a little sad because of what we've lost. And but that doesn't mean that has to be your new form of life. It just means that you're going to go through a period of not only withdrawal but also a period of loss, and that's going to be a normal sort of behavior and reaction you're going to have. I talked about this at our first show, but I want to be sure you remember. Our first reaction is always being stunned, or it's being surprised. I can't believe this is happening. Then of course we go right into denial and say, it's not happening to me, it's happening to everybody else, but I'm immune. And of course, we lie to ourselves a lot during denial, but those are the first 2 major levels of dealing with loss that we all go through as humans. And then the third level is anger. We start getting mad at what's happening, and we get mad at each other, we get mad at the president, we get mad at whoever is trying to help us, and without realizing that, we're really out here trying to help each other. And so getting angry will be normal. So I have I took a drive this morning real quick, and yes, there are people that are on edge. I've got the bird deployed toward me this morning, and that's fine. People are doing what they're doing. They get upset, but anger is a part of the process. It's a part of the grieving process. But after anger, you get into another piece, which is where you start to negotiate and you start to rationalize what really is happening. And then finally is resignation, where you actually accept the fact that we are in a new normal. This is a new way of life, and we all have to figure out ways to be successful and to continue our lives moving forward. So we want to be at the front of that for you. We want to help you with that. And because I myself, as a Chamber of Commerce, we have 560 members. We were counting that the other day. It doesn't mean a thing, because if our members are scattered and if our members are losing their business, then I take responsibility for that. I want to help them. So I want to help you. And the best way I know how to do it is through technology, doing what we're doing right now. And I see my glasses are falling again, but I caught them, and helping you out. So by all means, guys, being stunned is okay. But get out of your of that state as fast as you can, because you want to go into the next portion or the next state, and you'll deny it a little bit. You'll say everything is fine. You have plenty of money in the bank and everything is fine. Everything is good. But that doesn't mean that it's reality. It just means that that's your reality, that you could be denying things that are happening around you, which is pretty dangerous. I've done that before with my health. And I got to tell you that it almost cost me my life. So I know how dangerous it is to deny the realities we're living in right now. Okay? So with that being said, if you don't feel right, if you're coughing, if your chest is getting congested, if you think you might be coming down with something, verify, guys. Verify as fast as you can. And we have a number. We gave it to you yesterday. I'll put it in the description as well. But the number for sure, where you can get checked out, you can call this number here in Houston. It's 832-393-4220. 832-393-4220. They will ask you a bunch of questions. And there's actually medical professionals there that will ask you questions about your health and what you need to do. And the only way to get a test and a drive-through test places right now that are established, I think there's 3 or 4 in the greater Houston area. Go figure. What is it, like 6 million people in the city, and we have 3 or 4 testing sites. So you know that there's a line for these things. You have to have a code. You know, it's almost like it's password protected. And the way you get that is by talking to somebody on the phone about what's happening to you, right? So we give you that number. I'll give it to you one more time, 832-393-4220. All right, so one of our members also that we've been featuring all week, this is Meridian Springs Primary Care. They are medical doctors, and this is a medical professional who will give you telemedicine. But telemedicine basically means that you get on the phone or you get on your Skype or on your Zoom or whatever, and you talk to a medical doctor straight up. You don't have to go to their clinic, and they do that for only $35 a month right now if all you need is telemedicine. If you need more than that, they have a broader, a better program, which is $65 a month. But go think about this, guys. $65 a month puts you in front of a medical doctor whenever you need that person. Think about your health insurance right now and about what's going on with everything in the country. I know I have elective surgery that was put off till who knows when. Having access to a medical doctor who wants to talk to me about my condition right now, if I go through the healthcare system, is almost impossible right now because they're all fighting for what they're fighting for, and it's very different than my situation. So having a service like what Meridian Springs Primary Care offers is gigantic, right? So $65 a month gets you all these services. $35 a month will do it just for telemedicine. If you're a healthcare professional, they do it for free. Right, so if you're in healthcare and you want to talk to a medical doctor that's a third party, someone that's of course following all the HIPAA guidelines and making sure that all of it is very discreet, etc., you can talk to these guys. Here's the number: 281-826-1359. 281-836-1359. You can talk to them, sign up, talk to a medical doctor right now, and make sure it's $35 for teleconsulting. Actually, no membership needed. Thank you, Sunil, for clarifying that, and thank you that my glasses didn't fall off. I was able to read it. This is why I'm wearing glasses. So $35 for telemedicine or teleconsulting, they'll call it. You don't need to be a member, but if you do want to become a member, it's $65 a month. That's actually nothing, So maybe you can tell us what it is for a child. I think it was a lot less. It was just really inexpensive if you're a young person under a certain age. And Sunil will give us the number. But actually, you can call Meridian Springs at 281-826-1359. If you have any kind of condition and you need to talk to somebody, they will help you. And this is a great service, guys, because right now they probably won't offer you an appointment. Now, if you have children, check this out: $10 a month if you have children for each one of your babies. I know some of you guys have a lot of kids. For $10 a month, you can talk to a medical doctor straight out. Right, you can actually show them your baby and say, look what's going on with my kid, and they can help you. Telemedicine, guys, it's one of the future modalities of medicine, and I got to tell you, it's a wonderful way to address some of your concerns. Right. So remember, if you have any kind of concerns with your own feelings and what's going on, mentally or emotionally, we already know. You're going to go into shock. You're going to go into denial. There'll be some anger. There'll be some negotiation, but hopefully you'll come out on this end and you'll begin to just understand what's happening is happening, and we've got to make things happen for our families, for our loved ones, and for each other's business. I talked to you a little bit about loans, a little bit about money, and a lot about your health. So, and of course, remember that the census is a very important thing to do. All right. So by way of announcements, if you have any questions, like I said, please put them on the screen here. But we have some announcements for you. Next week, Tuesday, we have our Chamber of Commerce Town Hall. And we're going to call it a town hall, but it's basically a monthly networking meeting. We're going to do it through Zoom. That's also going to be in the description of this meeting today. So you'll know that the Zoom, what the number is. There's not going to be a password, but it'll have a number. You can join us as a Chamber of Commerce. We're going to ask you to introduce yourself, give us, a little bit of description of what you do, who you are, and then from there, hopefully, we're going to encourage our members to use your services. So if you are a part of our Chamber of Commerce, we want to stay together. We want to make you as relevant as we can during these times. We want to put you at the forefront. So with that also being said, if you would like to be on the radio, we have a podcast every day, virtually every day. And you can talk to Tom Brody at our Chamber of Commerce. He's the guy that hosts the shows right now. You can call us at 832-436-8956. That'll also be in the description. But if you want to be on the radio, especially if you have a public service announcement or if you have something that you need to get out to the media, also with our partners, KYST 920 AM with Matthew Velasquez, La 920. Basically, that's all in Spanish, and it's an incredible way of getting the word out to thousands of people. So if you have something that's important that you need to get out to the community in English or in Spanish, reach out to us. We're happy to expedite that and to help you. If you're a member of this organization and you want to be on the radio or you want to have a podcast because your business requires such, sometimes a lot of businesses, people don't know you exist. It's amazing. But radio, people are listening, and they do listen to podcasting, and they do listen to this that we're doing right now. If you need any of that, reach out to us, 832-436-8956. All right, so one more time, I'm going to repeat some of the numbers that I gave you earlier before we close this meeting, and just so that you have the information in case you need it. Remember that please like and share this video. It's also going to be on YouTube, obviously on Facebook, but we're putting it on YouTube, and we're going to turn all of this into a podcast at some point. So, all right, so like and share, etc., etc. Okay, so the numbers are, if you want to look at getting a loan, if you want to look at money, SBA.gov, right? So you go there and you start the process. Reach out to us if you have any questions. There's like 5 or 6 different people who do accounting for a living, and our CPA also has a lot of information for the chamber that I will happily share all that with you. It's just so much information. Just reach out to me if you have those questions, and I'm happy to share it with you. All right, to get yourself checked out on the telephone to see if you need to have a drive-through exam, you can call 832-393-4220. They will ask you questions. Hopefully the line is not too long, and they will give you a code, and you can go get a coronavirus examination. So it's 832-393-4220. Meridian Springs Primary Care. If you have a child, it's $10 a month. If you only need telemedicine, it's $35 a month. If you want a full-service medical person talking to you all the time about your conditions and about your things, it's $65 a month. We totally encourage you to look into this, guys. If you want to call Meridian Springs, please do so right now. 281-826-1359. They're waiting. They want to talk to you, and I encourage you to do so. So with that being said, I think that we've covered all the points that I wanted to cover today. Thank you very much for being on our show. Thank you for listening. Remember to share all this. Ask me questions as we move forward. This program will continue to improve. I'll continue to bring you everything I can to help you. And we'll see you again real soon. I'm Dr. Carlos Sanchez with the Texas Gulf Coast Hispanic Chamber. We are mytexaschamber.org. And please like this. Please share us. And we'll see you again tomorrow. All right? Thank you. Goodbye.